Difference between psychiatrist and psychologist. The main difference between a psychiatrist and a psychologist lies in their training, approach, and treatment methods. 1. Education and training. 2. Psychiatrists are medical doctors, MDs or DOs, who have completed medical school, followed by a residency in psychiatry. They are licensed to prescribe medication and often focus on the biological aspects of mental health. Psychologists typically have doctoral degrees in psychology, PhD or Psy.D, and are trained in psychotherapy and psychological testing. They do not have medical degrees, so they cannot prescribe medication in most places, but they can provide therapy and conduct assessments. Approach to treatment. Psychiatrists often treat mental health issues with medication, though they may also offer therapy. They tend to focus on the medical side of mental health, such as diagnosing mental illnesses based on their biological or neurological factors. Psychologists primarily focus on providing talk therapy, such as cognitive behavioral therapy or psychodynamic therapy, and psychological assessments. They look at the emotional, behavioral, and mental factors affecting a person's well-being. Roles. Psychiatrists are often involved in diagnosing severe mental health disorders, e.g., schizophrenia, bipolar disorder, and managing complex mental health issues with medications or other medical interventions. Psychologists work more on helping individuals cope with life's challenges, mental health issues, and emotional struggles through therapeutic techniques. In short, psychiatrists are medical doctors who can prescribe medication and often focus on the biological aspect of mental health, while psychologists are experts in therapy and assessment but cannot prescribe medication.
Psychiatrists often have to approach the disease based on two factors. They are psychosis and neurosis. Neurosis often deals with conditions which involve dysfunction of the parts of the brain, whereas psychosis involves biological aspects. This is the difference between psychiatrists and psychologists. The main difference is psychiatrists are doctors who studied bachelor of medicine and bachelor of surgery and then did a post graduation course in psychiatry, whereas psychologists are phd uh, people who have phd who have done phd in psychology, and then they cannot prescribe medication.